So hello everyone and welcome to today's Zoom session hosted by asep and myself. Today we are joined by Tony Widmer, who is from GSIA, who will give a presentation on GSIA and in the pharmaceutical industry. Just a quick sort of brief plan on how this session will go about. So basically, there will be as I said, a small presentation on GSIA, followed by a question and answer session where you students can either send your questions to me directly in private message, or ask your questions directly, using your microphone and all that to Tony. Yeah, I think that will be it. And if it's okay with you, to keep your questions towards the end, but you can still send me your questions during Tony's presentation if you prefer it like that. So without further delay, Tony, over to you.
Thank you very much. Pleased to be here. I just resonate your words, Deval. I will not be here try to advertise something. So I really try to give you a short introduction, what the GSIA is, what we do, what our strengths are, and how we build up our network. And then in the second half, I brought a few slides with me, talking a little bit about areas. I have a slide about salaries, where the jobs are, how a day looked like in pharmaceutical industry. So the idea in the second half is to be really interactive. So I would like to avoid that we have I'm telling you a story and you just listen and take your notes, especially then for the second parts, whenever you have burning questions, also you put on your video, ask the question live, because I'm here to answer your questions. I'm not here teaching you a lesson. So that's very important for me. So I'm here to help you to get the information that you need from us. So then let's start sharing screen. Okay, Deval, quick nodding, screen is visible. Okay, good. Then let's give it a go. So I don't know how many of you got to know the GSIA already. We're the Swiss Society of Industrial Pharmacists. And we're founded actually in 1957. So we're quite, yeah, I don't know if you can say old for such a society, but we're well established. And the reason why we were built is actually that we were looking for a connection where pharmacists from industries can actually exchange. And you can imagine back then, there was no Zoom calls, there was no Facebook or no social media, there were even no emails. So it was a very important, let's say, tool to connect among the pharmacists working in pharmaceutical industry. So meanwhile, we have approximately 700 members. Majority of it is working in pharmaceutical industry directly. We have some colleagues working in consulting. We have colleagues from all across the globe. So we have 35 nationalities. We have a nice gender distribution of 50-50, which also showing you that the pharmaceutical industry is quite attractive for part-time solutions, and it's relatively easy to combine family and job. Also here, if you have questions later on, don't be shy. We have a board which is consisting of 12 members, each having different areas where we exchange regularly. We are a member of PharmaSwiss, for those of who you know, and we have also the GSIA Foundation, which is basically a partner organization where we support master thesis prizes, fellowships, and stuff like this. Then probably why the GSIA could be of interest for you, and that's probably also why Deval came to the idea to invite us today, is our goals and purpose. As I said initially in 56, when we were established, our main idea was to build a network. So that's still one of the main goals of the GSIA. So we try to network or to get the people connected in the GSIA itself. You know, people from Roche, people from Axtelion, people from hospital pharmacies, but also together with the organizations that are associated. So the SAP, the Swiss BIPG, the APV, and of course the asep. We also contribute to education. So many colleagues of mine from the GSIA are giving lectures at ETH in Zurich. We have a few colleagues. We have a few colleagues in Bern. And in Geneva, I would lie, but I think even there we have some colleagues giving you some lectures. Then we promote young professional talents by giving a prize for the best master thesis. We also organize immersion days for students at ETH, in Uni Basel, and I think we also plan one in Geneva, where we try to connect the industry and academia, because usually there is a bridge between the two, or there is a distance between the two, but it's quite easy to bridge them actually. We have also an engagement and support education, also on a more political level, you know, exchanging with the university, talking about education programs, what needs to be covered, what are the demands and the needs and the requirements from the industry. Here is the board. I don't want to lose too much time on it, but basically we have different sections. We have people who are in PharmaSwiss, we have people writing protocols, we have people like me connecting with the students, we have the foundation, because there are so many, let's say, tasks that we need to cover, and we are a non-profit organization, so none of us is getting a salary. So this is why we have 12 people distributing the responsibility of the board. Then I was talking a little bit about the networking. Of course, I mean, we're all fed up by this corona. We hope we can see each other in real life in the future again. But here are just a few events that we did. So for example, what was a very nice highlight was we went to the new Roche Tower and had a beer on the top floor, enjoying the view, you know, connecting, networking. We had company visits at different companies. So we went to Elanco in Nunavut, just across the border in Basel. We went to Zeller AG. Probably those of you who have been in a pharmacy know they're a producer of herbal extracts. We went to UCB, you know, we went to Swiss Caps, but we also did stuff like we went to the Paul Scherrer Institute, which is much more academic, and had a look at proton therapy, sorry. So typically, you know, before we go here, so typically what we try to do is like we organize events, and then every GSIA member can just apply online, and then we meet there. Typically there is a tour, you know, some experts are explaining us the background. We can visit some facilities, and then typically later there will be an apéro where people can connect. So you see, again, it's all about networking and connecting people. Then promoting the future talents, we have basically a level-based approach. So in high school, we do information days in Basel and Zurich. Then during the bachelor thesis, we have different contacts in Fachhochschule Nordwestschweiz. We go at information day in Basel and Zurich. We have these immersion days in Zurich, Geneva, and I think now this year also, or last year also in Basel. And then we have the master prize in pharmaceutical science or related. So you can see we build it up piece by piece, trying to have something ready for every education level. And then for PhD and postdocs, we have the PharmaPro in Basel. And I think last year we had even one in Geneva. So we try to also come into the French-speaking part of Switzerland. Here, these are the most recent winners for Master Thesis Prize. So you can see we gave one in Basel, we had one in Geneva, we had one in Zurich, we had one in Bern, and we had one in the Fachhochschule Nordwestschweiz. This year's were submitted. I don't know if the winners are already acknowledged, so I will keep quiet and not spoil the winners. But I think some of them probably I even saw in the visitor list, so let's see. Then promoting the young professionals. Here are also just a few pictures, you know, from the Pharma Pro in the University of Geneva 2019. Then in Basel, we were 2020. Let's see if it can happen this year. We also went to the NPSV last year. If you look close on the picture, that's even me having an information stand and try to answer all kind of questions from you students related to industry. Unfortunately, this year we cannot have a live event, so keep your questions for the next session. I'm happy to try to cope with that. Then for those of you who do not really have an idea yet what the industry consists of, we try to group the jobs across the industry that we have. And we know we have one big group of us working in research and development. We have quite a big group working in engineering, you know, plant facility, stuff like that. Then a lot of pharmacists are actually needed in production, qualified persons. Then a few of us even made it to marketing and sales, you know, because you're coming from the product to the customer need. Then with time, many people also emerge into project management, because once you're more senior, that's a typical role you could develop into. We have a lot of people working in quality, you know, quality assurance, quality control. Then we have a few colleagues working in clinical research. Here I have to be honest, those are mostly non-pharmacists, so they're more coming from a medical background, biology, cell biology, biochemistry. And then we have quite a fraction of colleagues working in the regulatory affairs. In case you want to know more about these job areas, you can visit our homepage and click on the job areas. There you also find an interview where people describe a little bit what they're doing in their daily life, you know, in order for you to get an idea how a job looks like in industry. Here you have the numbers of our GSIA members. So you can see majority is working research and development, quality, regulatory affairs. Production, we have a few, marketing and sales, very few, clinical research, even fewer, and others. And other is also including consultancy in all kind of means, you know, personal development, quality, development, all kind of stuff. Then, of course, we have some related organizations. You from the asep, the Swiss Academy of Pharmaceutical Sciences, APV, or also PharmaSwiss. Of course, we try to have a regular exchange with them, you know, also to get a feel of the pulse, what are their needs or our needs, where do we have common ground, and where do we need to build bridges. As promised, I do not want to spend too much time on introducing the GSIA and tell you boring stuff about an organization you probably know or don't know. I would like to really spend most of the time on your questions. So let me switch the presentation. And select the next one to give you a frame for your questions. Okay, before I hit the road, any burning question that already popped up? Anything burning you like to know? You know, Daval, can you do me a favor and watch the chat, because I think I cannot see the chat.
I haven't seen any questions anyway, so yeah.
Okay. Also here, don't be shy. You don't have to type, you know, just put on your camera and ask. I will not bite, I promise you. And there are no stupid questions. Worst thing that can happen is that I don't know the answer to your question. So here, we were talking a lot about where people work, and probably all of you have seen this typical slide where you see the different stages of product development in pharmaceutical industry and where people can work. And as said, we have a huge part working in this area, research and discovery or development. And then, of course, many of my colleagues with a pharmacy background work also here in this area. I apologize, just the rest of my family come home, sorry. So with you again. And of course, what's also very beautiful when you work in industry, you can imagine that research and discovery or preclinical development or also clinical development, they have very different requirements. From project management to bench scientist to project leader to, chemistry, safety, biopharmacy, biology, you name it. And this is something that's really, really cool also if you work in a big company, because you have a lot of freedom to select, or even better, you can start at one point and evolve in another direction if you start realizing that you like the interaction with this line function or this area. I think here we already spent some time on it, so let's skip that. Another one that I'm frequently asked is, where are the jobs? And here I found a very nice map where you can see where the jobs in pharmaceutical and chemical industry are. Of course, you have the typical usual suspect as the top employers, with Novartis and Roche being by far the two biggest pharma company. Actelion now belongs, of course, to J&J, but still has a 2,500 position. Then we have Janssen, which is quite big. And then the numbers start decreasing relatively fast. So overall, we had 2016, we had about 45,000 positions. 2018, we had about 47,000. And I checked the numbers last week, but they were not online for 2020. So you can see, even though it's a challenging and competitive environment, the number of positions is still increasing, despite that some of the economy is actually decreasing. What's also quite obvious is that the majority of the positions are around Basel. We have a strong footprint around the Lake of Geneva. Then in Wallis, of course, there the big footprint is from Lanza, and the rest are relatively small positions. So if you want to join the pharmaceutical industry, the chance that you end up somewhere in the surrounding of Basel or the Lake of Geneva is quite big. Then another question which I frequently get asked is about who are you, what are you doing, and how does your job look like? So previously I was introducing you the GSIA, or I was introducing the GSIA behalf on the GSIA. Let me lose a few words about myself. So I studied pharmaceutical sciences in the ETH in Zurich. Then I continued a master curriculum called Master Industrial and Pharmaceutical Sciences. Nowadays it's renamed, it's called Pharmaceutical Sciences. And we were, I think, the second year where this course was actually available. Then I went to Novartis to do my master thesis. This evolved then in a PhD thesis, which was done with the university in Germany and in cooperation with Novartis. And since about 7 years now, I work in preclinical development in a small group in Basel headquarters, Novartis. And here on the slide, I brought you, let's say, a rough summary of what I do all day long for those of you who cannot really imagine how it could look like. So as you all guess, and quite familiar, reading and answering emails is a big portion of my day. So typically I get between 10 and 50 emails a day. And they are from all kinds of means, could be organization, strategic, scientific topics, everything related to that. Then we have a lot of meetings because we're an international company and we work in a matrix environment. So you can imagine you have a team that is running a project, and this team needs input from different line functions, from different experts. And when you have so many teams and experts coming together to run one project, of course, you create many interfaces, and all these interfaces need to be maintained. So therefore, we have a lot of meetings. These meetings are, as said, with different line functions. So personally, I work a lot with preclinical safety, with pharmacology, pharmacodynamics. Then I'm compiling the data of the compounds. So in preclinical development, typically we get the compounds from research and we try to look at them, do the risk assessment and define how can they be developed and if they can be developed. So that's also part of my daily job. Then, of course, if you have so many meetings, you need to prepare them. So, making slides with data summaries, with strategies, putting workflows together. At the moment, we're building up a new group in India. So we're putting together the curriculums, what the people in India should do. Then we prepare lessons learned. Whenever you make a learning in the company, of course, or maybe even a mistake, we need to make sure that they don't happen. So it's the team's responsibility to bring these learnings back to the company and the colleagues to learn from it and go further. Smaller and smaller gets the portion that's associated to lab work. But nevertheless, we plan, discuss experiments, review data together with the benchtop scientists, putting data into perspective of the projects. We give and receive trainings, of course, because we get new project or we get new colleagues, but also we get new challenges. So we need to get trained from people which are more senior than us. One of my personal hobbies is troubleshooting of late phase projects, because you can imagine I work at the very early phase. So if you remember back the arrow from the development, I'm in preclinical development. And for that reason, we're very flexible. So we don't work under GMP. So, if they need in late phase, if they have some issue they cannot resolve, often they come to us. We look at the problem, we give them a hint, and then they can do everything under GMP. Lab work, I have to be honest, since the Corona crisis, I haven't been to the lab anymore since a year. Previously, there are a few experiments where I have a scientific background that I still do myself, but classical day in the lab and then writing lab journals, those are gone for me. Then a small hobby is like maintaining or maintenance of lab equipment. I'm responsible for the HPLC and some other equipment in our lab because we're a pretty small group, so everybody has a bunch of equipment that he's responsible. Maybe let me have a stop here and ask if there are any questions arising already, either to me, my past, my daily life, anything you'd like to know.
I don't know if we should keep, there are some questions already, but I don't know if we should keep it till the end after you've completed your presentation. Do you have any more slides after this, or?
Let's see, I have 2 slides, but it's really up to you. So if the questions are related to the slides, we can have them right now, And I said, don't be shy, put on your video and just ask a question, don't worry.
I think we only have 2 more slides left. I think we can wait a bit.
Okay.
And then maybe we'll get some more questions here.
Okay. But I think what's also quite crucial is actually the weight that pharmaceutical industry has in Switzerland. So here you can see the percentage of the exports from Switzerland. So you can see that actually a majority, or we have a big footprint in watches, precision instruments, machines, those are metals and alloys. We have about 7% of chemistry, and a vast majority of 40% of all our exports globally from Switzerland are pharma products. So it's the most important export industry that we have in the whole country. So that's a good reason to work in that area. And the second one that's also very nice, I mean, we all hear about the big layoffs when pharma company, fire like 100 people or 1,000 people even. But if you look at the number of people employed in the pharma industry over the past years, you can see it's still increasing. And it's much more increasing than the overall economy and much more than the general industry. So that's also a very strong point that I want to make you aware that you selected a quite promising, let's say, area to work for. Then I think that slide's probably the most interesting of the whole presentation. This is why I keep it for the end. I heard that there are quite a lot of questions about what are entry salaries. And here I brought a list. I think those are the numbers from 2018 or 19 from the Bundesamt für Statistik. And what I wanted to tell you here is, like, if you look at the overall salaries, you can see that medicine and pharmacy is among the top paid jobs. So that's one big point. And the other point I wanted to make, if you look what the master is owning in the first year after he graduated, and after 5 years, you know, like this 86,600 and this 100,000, and then you compare it with people who have a PhD, so that's the bottom half, you can see that if you work 5 years from a master thesis, or if you do 4.5 years PhD thesis and then you enter the job area, doesn't really matter for the salary. So for those of you who wanted to ask me whether it's worth to do a PhD for the salary, no, it's not. I think it's really the work experience that's counting. And if this is from building up from a master or from a PhD, doesn't really matter. And here you also have some numbers, you know, when you talk to HR, that you have at least a rough guidance what's realistic. Then I have a few more slides, but I think they're not really of interest for you. What I can do is I can summarize quickly some take-home messages. So we have very diverse job opportunities, you know, from preclinical development over chemistry to project management, sales, marketing. So the variety is very broad. What's also nice is typically you work with experts from different areas. So, you know, you don't work with chemists only, or you don't work with pharmacists only. So we have a variety of backgrounds that need to come together, because one single project is so complex and requires so many things that there is no way out of this matrix environment. In the previous slide, we talked a little bit, the financial compensation is quite decent compared to other areas. What we didn't really talk yet, but what is an important point I want to bring, is that the job environment is very international. So it's dynamic, but it's also competitive. And this is an experience I made in the past, a very negative one. When I went to the ETH, people are telling me, you're the creme de la creme, you know, people in industry, they will fight for you because you have an ETH background. And then I came out of the ETH and I realized that nobody cares in industry, you know, because you're competing with top people from Asian countries, from the US, you know, from all over Europe. So you need to be aware that just because you go to a good university and you have a PhD degree, there is still a global competition around you, and nobody really cares if you're coming from Switzerland or not, which can be good or bad depending on what nationality you have. Pharma is one of the major economics fields in Switzerland. Majority of the jobs are also within global players. So if you join pharmaceutical industry, the chance that we see each other in the future in either Russia or Novartis is quite big. And what's also quite positive is that many roles can be obtained through different educations. You know, when you do project management in early phase business, it doesn't matter if you have a background in chemistry, biology, medicine, business, engineering, you know, we can extend the list as far as we want. So that's also something very positive, that you can be aware that, you know, just because you start with a job and you don't like it anymore, doesn't mean you need to leave the company. It means just that you need to develop into another direction. And I think with that, I stop talking and we can open for the questions.
So thank you very much, Tony, for your presentation. So we move on to the questions. The first question I've got is, having heard that the industry is complicated for part-time, I was wondering how true is that? So I think this person didn't join us at the beginning when you were telling us about the sort of proportion of part-time work in the industry. If you can just repeat that, please.
Yeah, sure. And I can even elaborate a little bit further. So you heard it, the rest of my family come home. So I can just share from from my part of view. So I'm working part-time. I'm working 90% life work balance, which means I get an extra 14 days of vacation, which I use to take off every Friday to watch after my son. My wife is doing a 60%. She's not working in pharma industry. So if you ask for it, you get it. And what's also quite cool, at least in the big pharma companies, if you became a parent, no matter if you're a mom or a dad, you get 16 weeks of paternity leave. And I think the industry starts to realize that this part-time model is very important, because our generation, especially your generation, we're not only after the big money, we're also after a certain life-work balance. So I cannot talk for small pharma companies, but for Novartis and Roche, part-time is really easy to do, even if you have project responsibility.
Thank you very much. The second question is, what are the qualifications needed to become a GSIA member?
Now you need to translate me the abbreviation. What's a GSI?
So in German, I forgot what it is in German, but the Swiss Association of Industry Pharmacists.
Sorry.
Yes, your association.
Yeah, sorry. Yeah, I'm so used to the Swiss abbreviation.
Sorry.
So actually, it's very easy. You need to work either in pharma industry, or you need to work in education for pharma, somewhere at one of the universities, or you're in your master program. So just go to our homepage, www.gsia.ch, and there is a section becoming a member, and there it's specified. And the cool stuff is, if you're a master student, there is even a discount. I think you pay $30 instead of 50 or 70. So as long as you're in your last year of the master, you can join us for a reduced fare.
Thank you very much. Third question, what are the qualifications needed to be able to work on pharmacovigilance and toxicology?
Here it depends what you're looking for. So first of all, that's not my area of expertise, but it really depends. You have two ways. One way is that you are a subject matter expert from university and you grow your career from there. The other one is that you just develop your career in a horizontal way. That you start somewhere else, you start approaching the topic, and then you slowly merge into becoming a subject matter expert from that area. But of course, the easiest way is, do an internship in a toxicological institute, do an internship related to safety assessment in one of the pharma companies, and build your career from there.
Thank you very much. Someone else asked, is it better to work in these fields in industry or in the public sector?
I did not understood this acoustically. In which fields?
In these fields in industry, so I'm guessing the fields that you highlighted in your presentation, or in the public sector.
So the quality was very, very bad. I still don't understand the question.
Okay. Can you hear me properly now?
Yeah.
Okay, so the question is it better to work in these fields in industry or in the public sector? Maybe the person who asked, if you can sort of specify what you mean by public sector, or which fields in industry do you mean?
Yeah, as said, don't be shy. For me, if you put on your camera and talk to me, I even have a face, which makes it easy because I'm just talking to the screen. So what do you mean by public sector? You mean the pharmacy?
I'm assuming that's it. I mean, yeah. I think that's a bit ambiguous. The person who asked, if you can maybe clarify later on, what you mean. We'll move on to the next question in the meantime. So next question is, well, you already, I think, touched upon it. This person asked, is it necessary to have a PhD to work in the industry? You said no. What options do I have without a PhD, more specifically?
Yeah, I mean, a misperception is often that once you have a PhD, the entry into industry or into your first job is easier, but it's actually not the case. Because, you know, put yourself in the other parts of the hiring process. You have a team, you know, somebody left, you need to replace somebody, or you need to hire a new employee because you get more work. And then depending on the level of education you have, you need to pay a different salary. So first of all, it's a question of the price of a PhD. You need to pay a higher level than, for example, a master's student. So that's the first one. And the second one is, if you make the wrong decision with regards to your personal, you're going to pay that, because, you know, maybe it will disturb the team, it will not deliver, it will not work out with the chemistry within the team. So you will not be successful in moving those projects. So the easiest way or the simplest way is that you rely on somebody that you already know. And what's the easiest way to get to know somebody without obligations? A traineeship. So here we have the same staggering as well. You know, if you do a traineeship as a master student, there is a fixed salary. As a PhD, there's a fixed salary, and as a postdoc, there is a fixed salary. And now, if I wanted, let's assume I have a project, you know, and we don't have the lab capacity to house this project in-house. So then I put a project plan together, say, you know, like I need 2 FTEs doing this and this work in the lab. Then I go to my boss and say, look, this is the idea. Do you see the added value? And he say, okay, I support you. Go to finance and ask for the money. And now you go to finance, ask for the money. And now if I ask for a postdoc, I need to ask 3-fold the money than for a master student. So the chance that you get an internship as a master student is much, much higher than getting an internship as a postdoc, just because you need to pay much more and you don't know what you get. So long story short, if you're looking for an internship, look in your master thesis, don't feel like you need to be super high qualified to do it, because typically we look for your soft skills and not for your hard skills.
Thank you very much. Next question is, are there any fields in industry where a pharmacist diploma is needed? So by pharmacist diploma, it's the pharmacy degree, not the pharmaceutical science degree master's that you did it, that's available at ETH.
I think there is, for a qualified person, you need that, but I think that's the only one. So there is no benefit at all having the pharmacy degree. Here it's a bit difficult because I didn't do it. So, you know, what many of my colleagues, they did both masters and then decided whether they go to the pharmacy store or to industry. I did only the industry, but I felt like it would be a lost effort to do that. And also, you know, you get so many background information in these dedicated master courses that you will lack when you have the pharmacy degree. So I'd rather see it as a disadvantage.
Okay, because the next person also asks, which master would you suggest, you personally? So,
of course, I would just suggest the industry one, but it has also another very nice benefit. So maybe I tell you the story how I got to Novartis, and this was the following. So I was in this master course where we had, I think, like 70 lecturers from different companies. So, you know, all of them were coming from Roche, from Novartis, Actelion, from Ziba. I know Ziba wasn't effective anymore, but from many different companies, you know, Elanco, Animal Health, you know, CSL Behring. And they all had a module. And I liked the module from the guy from Novartis really a lot, because I liked his technical development, his formulation aspects and stuff like that. So I had an oral exam with him and a co-examinator. And, you know, I have no clue how I took the courage, but after the exam that went okay-ish, I just asked him, you know, like, I worked in a pharmacy. It was boring as hell. I will never go back. I like to work in the industry, and I'm looking for a master thesis with one of the big pharma companies. What would you recommend? Where can I connect, or what should I do? Then I walked out of this exam and said, how stupid can you be to ask that so bluntly to your examinator? And I forgot about it. And about 2 weeks later, I just got an email in my mailbox from this guy and saying, you know what? Put your CV and a motivation level and send it to that position. And the rest is history. I'm within Novartis for 12 years now. You know, just showing you how it went. And I did my master thesis as well, maybe because I was cheap, then I was offered a PhD thesis in the company and then a permanent position.
Thank you very much. Another question is it possible to only work in the lab? So I'm guessing, yeah, as in only, which I guess that means which fields require to only work in the lab.
Yeah, that's a tricky question. And depending on when in my career you would ask me, I would give you a different answer, because in the beginning was also, you will never be able to take away the lab because the lab is very important for me. But what evolved over time is like more and more you become subject matter expert, you become expert in leading projects, you become expert in connecting the dots. And meanwhile, I have responsibilities which, or let's put it the other way around, going to the lab, doing similar stuff is not a challenge that motivates me to come to work every day. So that's one part of it. And the other one that you also need to see is like at one part you will become replaceable because your salary will increase, your experience will increase, your qualification will increase. And you can ask yourself whether it's useful if you earn like $100,000 a year to put you in the lab if a benchtop scientist in India does it for 10% of you. So, you know, maybe this is not a very pleasant answer, but this is also one of the paradigms that we have. We just lost our unit in China because China is considered too expensive, and we moved to India because it's cheaper. So, you know, to summarize this classical lab work, at least in a high-cost country like Switzerland, is declining very fast.
Thank you. Second question, another question is, in which field is it easier or more available to get a PhD? Industry or like classical pharmacy?
I mean, the easiest is, of course, academia, because they're typically have the professor, they have sponsorships or funds they can spend on, so that's the easiest way. Pharmacy, I'm not aware. And industry, the difficulty is always you need to find a university and a company that are willing to work together. And I can just tell you from experience, the ETH, for example, is a nightmare because they have so many requirements, what you need to fulfill, that the big pharma company says, no, thank you, never, ever. The way out for me is I did my PhD together with the University of Würzburg, and that has a very simple story because the PhD supervisor in the company was a former working colleague of the guy who got a professorship at the university.
So networking, as you were saying, you were
exactly, yeah.
Thank you very much. Another question is, how easy is it to change from the pharmacy onto the industry? So I'm guessing by that she means if you've spent, I don't know, some years working in a pharmacy, local pharmacy, what sort of requirements are there for in the industry for maybe, or does it help having first started working in a local pharmacy before starting work in the industry?
I mean, where it could help is the whole soft skill story, because, you know, you were in contact with customers, maybe you were leading a small team of pharmacists, or you were doing the economics in the background, that you can try to sell as work experience. But other than that, there is really no benefit.
Okay, thank you very much. Another question is it better to have 2 master degrees from a foreign country or to have a MAS, I think that's master degree from Switzerland?
It doesn't really matter. It doesn't really matter because you need to be qualified and you need to convince the persons that you fit in their team, that you have the skill set that you need. that you're self-driven, you're motivated, you're energizing, where your degrees from. And I'm just talking of my daily life. I'm the only Swiss guy in the team. We have 2 Portuguese, an Italian, a German, 2 French, a Spanish, and a Polish.
Very diverse, as you said.
Exactly. And then most of what I don't know is where they made the degrees. I think the Portuguese guy made the degree in England, and all the others made the degree in their country of origin. So no, it doesn't matter. As long as even the university, I don't know if it really matters. I think your references and your CV is more important. And me personally, I never look at grades.
Okay, thank you very much. And the question is, so working part-time won't mean you work 100%, but only earn 60%. I'm guessing she means that.
Yeah, I think I smell the question. Just retype in case I go to the wrong direction. Working part-time has a certain danger, because if you work in a big company, there is always job, like you do your routine job for a few years and then you start to have side jobs, new work streams. Like me, I built up the group in India. You have super users, networks, and all that stuff. And it really depends on how you prioritize the work. And if you work part-time, you need to be very strict. So I don't work on a Friday. I switch off my mobile phone and I'm not accepting any meeting. And also in my disclaimer, it's, bold written, like, I do not work on Fridays and I do not accept meetings. And in the beginning, it takes a lot of courage to do that and also push back meetings. If you have like 20 people in a meeting and you're the most junior and you say, I don't join on Fridays, but it's really up to you. And I know people who suffer from that, that they're paid for like 80%, then they work 120. But it's really up to you. So you need to watch after yourself and talk to your manager in case it doesn't match your work-life balance. So for me personally, it pans out.
Okay, thank you very much. A bit more personal question. Were you well prepared for the working industry after graduation, or did you have any difficulties? And would you have any tips and advice for our students for starting in industry?
I think content-wise, I was well prepared with this pharmaceutical science master from the ETH. I know Basel has the drug science. I think in Geneva you also have a course. I don't recall how it's called. So from the knowledge-wise, I was well prepared. Where I had no clue was how it is to work in a global company, how it is to work in a matrix environment. Those were things I was underestimating. And it's also in my daily work, it's so much about communication, how you write an email, how you convince somebody to do something and you're not their boss. How do you get what you need from certain team members? How do you manage conflicts? How do you motivate your crowd when you have projects that go wrong? All this cultural soft skill stuff, I was hugely underestimating that. So if you ask, I hate to give advices because I'm not your dad, but if you want one, look into that. And also if you apply somewhere, make visible that you have some of those. If you're a board member of, I don't know, your volleyball club, or you're a bird watcher or whatever, put this stuff in, especially if you start from university, because this helps people like us to try to read whether you can fit the team. And this is not about that you're good or bad. This is more like, do you fit the purpose of the job or not? Because if you don't fit, it's going to be embarrassing for you as well as for us. And we end up in a bad situation that we don't want. So was that too parenting?
I think the person who has got the message. So basically, if I repeat, you do also focus on the more, I guess, I think we can say the more non-academic part. For example, if you, I don't know, part of as you said, you were mentioning volleyball, like sports association, but if you're part of maybe a non-academic association, you do also take that into account. Is that what you mean?
Yeah. And also here I can share what I did. So during my studies, I needed some money as every student. So I was working as a waiter in a big company, and basically people could say, you know, I need like 5 people behind the bar, I need like 10 waitress, and I need like 5 escort persons for an event, or, you know, and then you could apply to those, and then they select who will do the job. And I was starting there, and we had cool events, you know, like football player of the year. So I met Ronaldo, for example, or Hakan Yakin, and all these guys. I saw Lionel Messi. Um, but that's not the point. The point was more like I grew up, and then I became responsible for a whole team. And, you know, having this responsibility for such an event, I could already sell them as, yeah, like project management. And this helped me because I had exactly the same problem. I applied for a job having no direct experience. So I tried to sell the experience during my PhD because I was doing it in the company. And I tried to sell all these extracurricular activities to to show that I'm a team player, that I can, you know, work with people, and that I can get stuff done, and that panned out. So yeah, my advice would be do it. And also another funny story, maybe I'm brewing my own beer and I'm breaking my own bread. So I don't buy beer and I don't buy bread. And initially I was hesitant to put it on my CV, but you cannot imagine how many conversations I had about baking and brewing beer. So of course it depends if you have somebody who is like very old fashioned and say, oh, this guy is brewing beer, probably he's drinking too much, then you're on. But you cannot imagine how many informal talks you have chatting about beer, and then probably you meet for a business lunch, you chat about beer for 55 minutes and you do the business in 5 minutes, but you did the business. That's it. So yeah, try to put these extracurricular activities. You know, it also helps for us, like try again to see, do you fit the team? Do you fit the task? Do you fit the challenge? Do you fit the global environment? Yes or no?
I think that's a very, very useful message for all of us, because a lot of us, we think that, you know, we think that the human resources people, they don't care about, you know, whether I was part of the, I don't know, debating team or whether I was part of a student association. What they care about is my experience, my academic achievements, but that's not all, apparently. So basically,
No,
yeah. Hmm?
no, and you know, there is also a reason for that, because you know, you get a grade for what you did in academia and you passed it because in the end you get a degree. So how you get a degree, I think that's not so essential, but you will not get a degree like, you know, you can be a brilliant student, but an asshole. That doesn't help.
Yep.
You know, or if you are basically, you know, you're a brilliant scientist, but you spend like 24 hours a day in your own room, then you're a brilliant scientist, but in a pharma company, nobody can work with you. Now, I put two extremes to make the case. Of course, there are, let's say, many different, you know, shades of gray, but
Yeah. Mm. Thank you very much. Next question is, did you start directly, I think you mentioned it, did you start directly after your studies working in Novartis? And was it hard to get the position with all the competition, as you said, from people from other other countries, for example, other backgrounds?
yeah. So the way I did it, I did my master thesis. Then I was, I think, a master student for 3 months until I could start my PhD. And during my PhD, I had a work contract with Novartis. And the group where I did my PhD, where I did all the lab work and stuff, they had a position available. And basically, I applied for one of those positions. They were also typically looking for somebody with 5-year job experience. But in the end, what got me the job was that I knew some project work already, because during my PhD, I was working on actual projects. This is why I couldn't publish. That was the downside. But I could get some real project experience. That was the cool stuff. And the other one, what saved my ass in the end, is already then I saw how people treated some equipment in the lab and it always broke down. So what I did, I always fixed the stuff in the lab, you know, these machines, these HPLC machines for the whole lab, which showed them that I'm a team player and that I'm willing to give for the success of the group and not only focusing on my stuff, getting my PhD stuff done. Because my PhD had nothing to relate with their daily job. And in the end, I think this team player behavior was the reason why I got the chance, even though I didn't have any work experience. And I think they were asking for 5 to 10 years.
Wow. Okay.
So again, networking connections.
Mm-hmm. Thank you. The question now, it's a bit this question is a bit specific, and since you haven't exactly worked in a hospital pharmacy or even for the BAG, for example, do you have an idea maybe from colleagues or friends who worked who are still maybe working in hospital pharmacy or for the BAG? How is it in terms of the working conditions, the stress, and the work and private life balance?
Yeah, unfortunately, I have no clue about that. I don't know, in case this person is from the ETH, the GSIA, you know, this is the, let's say the opposite, or that's the pendant of the GSIA, but for the hospital pharmacy, I think they have a stand. So in case you're from the ETH, go and ask them directly.
Exactly. I was about to say last week we actually had a Zoom session with Sarah Eiten from GSIA.
Yeah.
So once again, to the person, you just need to send an email to Sarah Eiten, and she'll probably have a better idea since she worked in the industry and and as a hospital pharmacist.
What I can say generally, you know, it always depends on the team. Of course, you know, you can always bump into teams that are not very, you know, cultural behaving, respecting work-life balance. I think there is no general rule.
Thank you. One person is asking, what is your opinion on the drug sciences master in Basel compared to, for example, the pharmaceutical sciences master in ETH? Is it just as appropriate for industry pharmacy or a bit less? Is it more towards research or yeah?
Yeah, so I'm not familiar with the detailed content of the drug science, and I mean, of course, the one from the ETH is better because I did that one. No, I feel, at least I know some colleagues in Novartis that did also the one in Basel, and I don't have the feeling that they have a disadvantage. So I would assume they're equally qualified. And also there, the beauty is you have lecturers directly from the industry, which is a nice opportunity to put a foot into the doorstep in case you want to go to industry. So I think that's even almost, or in my opinion, that's even more important.
Thank you. Next question. When the industry or the human resources person in a particular company analyzes your CV, they care less about PhD and more about your experience, such as internship. Is that correct?
The difficulty is usually the first round of sorting goes by artificial intelligence, so they will look for bullet points or for keywords. And the challenge will be to survive this. And also, you know, probably, you know, every time I say we put $1 in the jar and you have a beer and the corona is over, the network is very important because you can, or the other way around, if you put a job offer from a big pharma company, you probably have like 100, 200 people applying for it. If you know somebody who knows somebody who gives that somebody your CV, you're 1 out of 5. And this would be my recommendation whenever possible. Make use of these networks, try to build up networks and, you know, increase your success rate by your network.
Thank you. One person's asking if we have to learn German to work in the industry. Basically, well, you said anyway that you're surrounded by people from different backgrounds and all that. So I guess English is probably the most useful and beneficial language to have.
I would say language number 1 is English. Language number 2 is French. Then comes German. And then you can select all kind of languages. But it's all about English, English, English. That I can speak some Swiss German, that's pretty rare, High German. And what I can just tell you, know, I feel really bad, especially as we have colleagues from Geneva. I spent so many years learning French. I never learned proper English. And my English by now is far better than my French, just because, yeah, I use it on a daily basis. So don't be afraid of the language, you will learn it. English is so easy. And if you speak any other language, it will be a benefit because, whenever or let's put it one way, I still speak some French, and we have 2 colleagues in the lab which speak French. And whenever it gets emotional or stressful or whatever, they complain in French, and it helps to understand and at least try to understand them and give them some feedback in French. So any other language that you speak is a plus, but not a must.
For example, maybe I'll put my own personal spin. For example, I'm originally from India, so I understand most of the most spoken language in India. And you were saying you are collaborating. I think you are helping develop some companies in India. So do you think that me knowing the local language will help in some way, or English will suffice anyway?
It will definitely help. It will definitely help, especially, in this case, it's also quite a culture clash. Understanding these differences, this can always be a benefit.
Okay, that's interesting to know. One question is, can someone who did the pharmacy master switch directly to industry pharmacy, or does one need to have further qualification in order to be able to switch? I'm guessing this person is asking if you got the federal diploma as a pharmacist, is it easy then to sort of immatriculate into the industry, for the pharmaceutical sciences master?
It depends which university you did it. I assume you did. So if you do it at ETH, I think it's consecutive. You just need, I don't know if it's still actual at my time, you need to have a grade higher than 5 and you're automatically qualified. If you come from a different one, I would suggest go to the page from the ETH, and there you can see the requirements. And I think they also said very clearly which modules you need to have, and in case you don't have them, what you need to do in order to step up to the level to be able to do it. So go to the homepage from the ETH, or I think similar for Basel, if you want to do drug science, I think they also have a list of requirements that you need to fulfill. But if you studied pharmacy, you cover like 95% of the topics.
Thank you very much. One question is regarding more your team. What is your team's mission? Like, what is the main project for now that you're working on, or what are you? Yeah.
That's a very interesting question, and that's probably a question I've never heard before, so I'm really happy to answer that. By the way, thanks a lot for all the questions, because I was a little worried that like after 5 minutes we run out of questions, so many thanks for all these questions. The mission of my team is basically, we're at the interface. So we have the research guy who are developing the molecules. They select the targets, they do the lead optimization, the whole chemistry. And then what you can imagine, like you have one target, but maybe you have 5 different chemistry series that bind to the target. And then you have safety, PK, chemistry in the background. And we help them basically to select the right molecule, because you can imagine, like, if you have a naked molecule, a white powder, it's a far way to make a tablet out of it. And typically the challenge is that the stuff is not soluble. And in order to get an oral treatment, it needs to dissolve in your GI, cross the membrane, and gets to the target, which is usually a protein somewhere in the tissue. And we spend most of the time trying to select the right molecules, which is never easy, because if you have a molecule that's soluble, usually it's not potent enough. So then we need to apply all kind of tricks to make it soluble again, or to make it amorphous, or to nanosize it. And my team's task is basically, we look at all these molecules. So I think our team sees around 500 molecules a year, and only probably 50 will move forward, because they're toxic, not developable, not efficacious, business reason, whatever. And what we help together with the chemist is selecting the best one. And when we selected them, put the risk matrix in place. So, there is a risk you have a low permeability, so you will not reach the exposure, or there is a risk that you will not be able to tox your compound. That's my job. So flag the risk and try to mitigate them.
Basically,
on small molecules.
Basically optimize the molecule to make it as, well, in this case, the most potent possible, the best tolerated one.
Exactly, and it's always, you can use it like a spider plot. So we have like 20 different vectors you need to optimize, and typically if you optimize for one vector, you get bad on the other one. So it's a question like to find the right compromise.
Mm-hmm. You're reminding me of my drug discovery teacher lecture. Another question is, so this person asking, we're always talking about your team. Does this mean working in the industry is very sociable, and you have a lot of contact with people?
Yeah, I would say my active network in the company consists about more than 250 people. And yes, so if you think like, you're the brilliant scientist sitting in front of a desk with formulas all over, just smoking your head, not talking to anybody and doing your science, that's the wrong picture. So actually, I sit in an open space office. If there is no corona, at the moment I'm sitting home. And you exchange, and you exchange like strategic elements, scientific elements. If people made similar experience, you ask for advice, you connect with your people. That's the scientific and the project part. But once you're a little bit more senior, there is also kind of political stuff, how to prioritize projects. How much do you want to accelerate the project? How do you deal with health authorities? So there's also kind of strategic political elements, and this you can never solve your own. So this is why I said this shows social and communication skills, they're key.
But valuable. Yeah. One question. So this was in regards to the question that was asked, because this person is saying that when she was looking for internships in companies, a lot of the positions were, the description was mainly written in German, or they had a sort of German speaking requirement.
This depends the areas. I would assume if you go to the career homepage of Russian Novartis, that if it's not production, that most of it should be in English. But at least for Novartis, it's going to be English. For Roche and the other companies, I don't know.
I'm guessing the bigger ones who invite employees from all over the globe, I'm guessing those will have more English as an environment, as a requirement.
Yeah, and what I also experienced is like typically R&D is typical English speaking. If you go more towards quality and production, it's more local language, so either German or French.
Thank you very much. One question we have is startup experience valued?
The voice quality was bad.
Sorry. Yes. This person is asking, is startup experience valued?
If a startup experience is of value.
Is valued, yes.
That's difficult to judge. The positive thing about a startup is, of course, that you saw many areas. Because typically, if you work in a big company, you have an expert for everything. So if you have a specific question, there is a specific expert. If you work in a startup, people would likely assume that you know how to help yourself. If that's an added value or not, I think that's difficult.
Mm-hmm.
This I would need to ask my HR colleague. I don't know. Mm-hmm. So sorry about that answer.
No problem. No problem. Next question. Are there any jobs in the industry which you can do with a bachelor's degree? So, for example, a temporary job within a gap year?
Yes, definitely. There are also internships, and I just know for Novartis, I don't know for the other companies, we also have summer jobs, like 8-9 weeks in summertime. And there, you can even be before the bachelor's, even a matura can be sufficient. Of course, those are typically not the most sophisticated jobs.
Thank you very much. Well, the question is, yes. What's the difference between working in academia and working in industry? I don't know if you can answer that.
I mean, I've never worked in academia, therefore I can only tell what I hear from my colleagues working in it. Many things are quite comparable. It's always about the money, it's always by when can it be done, and it's always about the revenue of your work. What was an interesting experience was like when I was doing the PhD, I was hired by Novartis, and basically the university was just guiding, and I had a mirroring PhD hired by the university in Germany, and basically we were advising on a scientific level. And I don't know if this is specific to Germany, but while one was specific to Germany, of course, the salary was different. However, if you compare Switzerland university, the salary is fixed anyway, so you don't earn more in industry or less. But what was super nice was I never had to argue to get my 5 weeks vacation. I had 40 hours work week. I think I can count the Sundays and Saturdays I went to the lab with like 2 hands. And it was not because somebody asked me, it was more because I was eager to get the data, and I, just walked to the lab on a Saturday or a Sunday. What else? All the other stuff you still have, you still have sometimes internal competition. You need to fight for the money, for the attention, for the recognition. I think one particular difference that just comes to my mind is the cool stuff in industry is once you start and you start to like a topic, you can develop into it. So let's imagine, me, I liked a lot formulation, but I start to develop a feeling for mentoring and developing people. So I go away from the formulator expert role towards more, building now this group in India. And I think or I could go to management or to sales. And I feel in academia, you don't have the same broad opportunity. That's probably the only difference, the real difference I could see.
Great. Thank you very much. Hope that answered that question. One person is asking regarding the internships for, I guess, bachelor students. Do you offer those internships on your GSIA website, or do we have to contact the specific companies and see if there are any sort of open internships during summer?
I mean, of course, it's the easiest is to look on the job portals. However, it doesn't hurt to ask, because it's often like that there might be none, but if you have somebody interested that and you get a recommendation, and they say, okay, let's create a summer job. So I would do both, actually. And also here, try to use your network.
Mm-hmm. Would you have, on the website, do we have any people of contact, or people that we can contact directly to set up, I guess, where to apply basically for summer jobs?
Not on the GSIA homepage. Of course, the big pharma companies, just have a look at the career portals. And I can also explain why we don't do it from GSIA, because that has a legal issue. You have corporate identity, and those do not allow that you post job positions outside of the mother company. Doesn't matter if you're Roche, Actelion, or whatever you're working.
Mm-hmm. Thank you
it's
very
not
much.
That we don't want, it's that legally we cannot.
Of course, understandable. I think that's all the question from the students. I had a question myself.
Yeah, sure.
So basically, if you do your master's thesis, for example, at a university, like where you did your bachelor degree, for example, and you were perhaps unable to do your master's thesis in an industry, in a company directly, when you look to do your PhD, does it, how would we say? I'm guessing it would be easier for someone who's done their master's thesis at the same company to then follow up with a PhD at the same company, rather than someone who did their master's thesis at the university and then is applying to do a PhD in a company, right?
Yeah, and the reason is very simple. Put yourself in my shoes. Like I said, I put a project together. I go to my boss, I go to finance. And the thing is, in the end of the year, you get a paycheck if you delivered or not. So if you screwed up and you don't met your goal, next year, your bonus is going to be cut. So basically, if you want to take the risk and have I don't want to be disgraceful, but a hobby and have a student project on the side, you better make sure it works out, because otherwise it shoots you in the back. And for that reason, of course, you want to have the highest level of confidence that this going to work between the team of, the supervisor, it would be me, and the students, which would be you, that we deliver in the end of the day. And if you did my master thesis, if we did the master thesis together, and I'm convinced you do the job, then I'm also willing to embark on a PhD. If I have no clue who you are, how reliable you are, what kind of team spirit you have, not because I'm saying it's a bad one, it just doesn't fit my group or my job, then I would be very careful to do that. And this is again the reason why I say do internships, do master theses, go there, show yourself, that people get to know you.
Mm-hmm. And if that's not the case, then during the interview process, provided you are, accepted for an interview, show what you weren't able to show because you didn't do your master's thesis at that company, right?
Exactly. Yep.
Okay, thank you. We have got another question. Looking back, would you say what you learned during your bachelor was important for the pharmacy industry compared to the master's thesis? Because I feel like some of the bachelor courses are quite interesting and very, how do we say, very sort of far away, very different from what you probably need in the pharmacy industry. For example, learning 200 plant names in Latin for phytochemistry and yeah.
Yes and no. I also hear, I hope that's okay if I share my experience. I went
Sure.
to ETH being crap at maths. I'm really bad at maths and physics. And what do you have the first 2 years at ETH? Shitloads of math and physics, and not like simple stuff, but they really torture you. And you can ask yourself, what does it bring? And recently I had a case, we had a project where somebody was really, really good at math. And you know what I did in experiment, he calculated. And then the synergy was nice because I'm somebody who has a feeling like, what's the weak spot of the molecule? And he could do the calculation. And when we talked together, we had extraordinary results and outcomes. So saying, I see the frustration. I don't need any maths. The only thing that I need, like if 100% is 55, what are 50%? I think that's sufficient. Sometimes I need to calculate a buffer concentration or a molarity or whatever, or, calculate the plasma concentration, but that's it. No physics, no math. However, if you have it, I'm sure you find ways to apply it. For the plant names, that's potentially difficult. I have a huge garden with many plants, and I can impress my friends if I know them a lot. But I think that's the only benefit of learning so many plants by heart.
I think it's mainly for bachelor. I think it's, to respond to this question, I think it's mainly what you do in master courses, whether you do, if you're an ETH, well, you have the choice of doing the pharmaceutical sciences or the industry focused master, or the pharmacy federal diploma. For example, here in Geneva, we only have the federal diploma. So, and to be honest, only I'd say 1 or 2 subjects are dedicated to drug discovery and development. So, drug discovery, preclinical, clinical trials, etc. All the rest are more sort of geared towards the pharmacy master. So that way it isn't that useful. But I guess for those who do the pharmacy master, I don't know if you mentioned Tony, but you can still sort of apply in a pharmaceutical industry company and then get experience from internships from that to make up for, maybe what you didn't learn because you didn't follow the pharmaceutical sciences master in ETH, for example.
It's probably a little bit more challenging, but it's not impossible.
Mm-hmm. Thank you. Are there any other questions? Those are the questions that we received by text. Those who are still here, are there any questions you would like to ask, Tony? Go ahead.
I have a question. Are there a lot of parts in the industry where you can travel, and not just travel, but you maybe go to another country for a year or 2 years and work there and come back?
That's no problem. I mean, of course, now with Corona, it's a little bit more difficult, but yes, that's possible.
Okay.
you know, there's always transfer, technology transfer, expertise transfer. There is also trend, you know, what's standard here in the headquarters and what's considered to be easy to do will go to cheaper countries. So somebody will need to transfer the knowledge. And those are always opportunities to go to a foreign country for a few months or even a year. That's easy possible.
Okay, thank you.
You're welcome. And then I see time is flying. So maybe a question from my side, you know, can you give me a thumbs up or a reaction or whatever? Was this useful for you? Could you get something out of it? Was it helping you to understand?
For me,
Okay,
double thumbs up, yes. Yeah,
you know, write to Daval or also to me if you have the context in case you missed anything or you would have wished to get some information about something. Let me know, because the idea is really to answer your question, not me, you know, advertising the GSIA or my company, even if I did probably.
Exactly, yes, as you said. For those of you who were wondering what the website looks like, I don't know if you can see the screen. This is the GSIA website. You can thank me later, Tony, for the free advertising. So basically, this is the GSIA website where you can get all the information you need about the association, but also for career paths. You can also look at basically what Tony was presented in his presentation, the different sort of fields that might interest you, and each part. What I found very interesting is that there's some kind of, I don't know if Tony, if you organize this, if you set this up, there's a sort of most common questions asked for each part. I found this very interesting, very useful. And yeah, if you have any questions for that, then just ask. And if not, if you have any specific questions to ask, for example, you can ask Tony, the representative of GSIA, and he would happy. I'm sure he would be happy to answer any of your specific questions.
Exactly. Yeah. I mean, you can also drop me an email to my business address. That's fine. Don't worry. But yeah, thanks. I think it's always more original if I don't have to show the homepage myself. So thank you for that.
No problem.
And a challenge to the crowd out there. You know, one of the job interviews is mine. So based from the experience you heard today, you can guess which one was me.
Exactly. So if I don't know if anyone else has any questions. If there are no more questions, I guess we will run into this session. And do remember that this is recorded, so it will then go up and it will be uploaded onto our website later on. You'll get an email from me from that. So yeah, Tony, thank you very, very much for having the time to come and speak to us. I really think that not only me, but it was beneficial for all the other students who attended. And yeah, looking forward to maybe hopefully seeing you in person at the next NPSV, for example, if it takes place. But until then, thank you very much and take care.
Thanks for having me, and I take this as a promise and not as a threat, you know, seeing each other live in person again. And thanks a lot for all the questions. You know, my worry is always that it's so boring that there are no questions. So having a lot of questions is definitely facilitating the whole stuff. Thanks also for that. And thanks, Daval, for organizing and moderating. Very well done.
Thank you very much. No problem.